Hello, everyone, and thank you for joining us. I'm Dr. KM Cheung, a thyro-oncologist from the Queen Elizabeth Hospital in Hong Kong. Today, I'm going to talk about deriving the thyroxine replacement dose in Asian patients and its relationship with age, sex, and concomitant medications. I have nothing to disclose. The main point of my presentation, there is currently a lack of data reporting thyroxine requirements in the Asian population. In a current study, age and calcium supplements were shown to be independent predictors of T4 requirements. In our cohort, the mean T4 requirement between 50 years old or younger was 1.83 microgram per kilogram, and about 50 was 1.54 microgram per kilogram. Concomitant calcium supplement may raise T4 requirement by 10 micrograms. The reason why I started this study is I often get our Asian patients over-replaced if we prescribe the T4 according to our current guidance. Currently, the full thyroxine replacement dose is reported to be 1.6 to 2.1 micrograms per kilogram. There is currently a lack of data reporting thyroxine requirements in the Asian population. Literature reporting per kg thyroxine requirement while controlling for age, sex, and concomitant medications are limited, and this study aims to determine the thyroxine requirement in Asian patients and its determinants. This is a retrospective core study. We included consecutive adult patients with history of thyroid cancer who received complete thyroidectomy and attended clinic follow-up. Included patients has to be both clinically and biochemically in thyroid with stable thyroxine requirement. Patients with concomitant active major illnesses, pituitary dysfunction, artificial means of feeding, were pregnant, or documented poor medication adherence were excluded. We measured the following variables on the list. We also determined the thyroxine requirement in microgram per kilogram and tried to identify significant predictors by univariate analysis and multivariate analysis. The effect of predictors will be presented by stratified analysis. We included 227 patients. Most patients are female and the median age was 59 on assessment, which is compatible with characteristics of differentiated thyroid cancer. Most patients receive RAI ablation of residual thyroid tissue, and therefore the requirement we measure is likely the full requirement. 1/3 of patients are in calcium, and they are routinely instructed to space out calcium supplement with their thyroxine replacement. 10% of them had iron supplement, 1% had PPI, and 20% of patients are on over 5 medications we call polypharmacy. For results, on univariate analysis followed by multivariate linear regression, age and calcium supplement were independent predictors of T4 requirement. We shall go through how age and calcium supplement will affect T4 requirement. On the left-hand side, we see the mean T4 requirement of 50 years old and younger is 1.83 microgram per kilo, and those above 50 is 1.54 microgram per kilo. The requirement between the two groups is significantly different. On the right side, the line chart shows that the mean requirements start to decrease after the age of 40, from around 2 microgram per kilo before 40 to gradually 1.7 microgram per kilogram in 40 to 50 years old, and then plateau around 1.5 microgram per kilo after 50 years old. On the line chart on the left, we see while as a whole, the requirement per kilogram between male and female are not significantly different. But a turning point for the decrease in T4 requirement is a bit different. In female, T4 requirements start to decrease from 40 years old, and the decrease starts from 60 years old in for males. On the right side, we see that across all ages, concomitant use of calcium supplement raises the requirement by around 10 micrograms per day. Our study suggests that T4 replacement dose might have to be personalized according to ethnicity, age, and considering the potential effect of calcium supplements. Thank you and enjoy the meeting.